Hi class, my name is Leo Mary Santaella and I am presenting my community plan. So community nursing is a concept in which this client is a community rather than a family or an individual. So during this community plan, I'll be combining the 5 steps of the nursing process, which are assessment, diagnosis, planning, implementation, and evaluation. But instead to be on a person will be on the specific community. So my community is Middleton and is in the state of Wisconsin. This is a city and the city was declared in 1963. The location is just minutes away from the state capital, which is Madison. And the city of Middleton in 2006 was considered one of the top 10 city places to live in the US. And then in 2007 has the rank of American Best Place to Live. So the total population is 19,723. The demographic basically are 87% of the population is white, 5% Latino or Hispanic, 4% Asian, and 3% Black or African American. So during the project, we have to perform a windshield survey, which basically we have to present the city, the name, the location, um, and some of the characteristics of the community. So just to highlight some of them, this is a place family friendly in which we can find mostly all the services that we need without leaving the city. Um, we have many services, and for instance, we have our fire station, our court, our police department. Um, we also have schools, high schools, grocery store, gas stations, pharmacy, banks, shopping malls, clinics. Um, we don't have hospitals. We have clinics, dentists, um, nursing homes, therapy areas, um, retirement communities as well. Um, we have also youth and senior center, churches, um, many areas, workplaces as well. Um, we have design companies, engineer design companies, retail shops, restaurants, um, and many other locations, hotels, services. The community is safe for children to play, for pedestrian, biking, and hiking. Kids are able to walk to school, and a few times a year they're able to actually bike to school, which is pretty cool to see. So just to describe, to present a few data from the city, we have again that the total population is 19,723. Population households is 19,642. Population families 14,473. Population density is 2,228 and diversity index is 36. So we already talked about the demographic, but also we have some population characteristics, which are veterans and foreign-born person, which was having a percentage of 8.8%. And also the households is 8,615 2015. Education, 97% of the population is high school graduated, and also 58.3% have a degree, bachelor or higher. The median household income is 70,105, and per capita income is 40,509. And poverty levels are 7.9%. The status of the community. So basically, we have, according to the Wisconsin Department of Health, a resident birth reported on January 31st of 2017 in Dade County was 6,047, and a total death of 3,257, which is a rate per 100,000 residents. Also, we have I developed some community partners that I would like to mention. The American Children's Hospital, which is part of the University of Wisconsin. They have a very good Safe to Sleep program to help educate families in safe environment. This Safe to Sleep program provides a lot of information to how to protect babies for sudden death. Basically, this is one of my topics, and another partner is the United Way of Dade County, which actually is have the vision to make possible that children and family can have access to healthy and cultural food appropriate to get better quality of life. This is an organization that helps the community of Dade County a great deal. It is important to my project because we'll getting information about malnutrition. So these two partners have also community resources, which is Wisconsin PRAMS, which is a division of the Public Health Department of Health Services. And this organization of these resources is to do surveys to the community, specifically to women, to find out the real needs, but specifically works on safe sleep practices. So, my paper is very important. And the other resource is the Second Harvest Food Bank of Southern Wisconsin. This is a charity organization whose primary objective is to make sure that every kid and everybody have safe and the correct right of food. It offers food distribution, promotes government programs, and promotes hunger awareness. And again, I'm getting information from these organizations to know how we can help parents to prevent malnutrition. So, the diagnosis of the community, I found that the community has a risk of sudden death among infants registered to daycare facilities in Dane County, Wisconsin, related to parents placing infants in cribs to sleep on their stomach. And the second second diagnosis is the risk of malnutrition among infants and toddlers in daycare facilities in Dane County, Wisconsin, related to parents providing inadequate meals and portions. So this information came out because I observed in a daycare, parents during drop-off placing their kids number one in their cribs, on their tummies, with blankets, with stuffed animals, and that is technically is unsafe. And uh, also during the meal time, the portions of meals for the toddlers were very, um, some of them have a lot, some of them have little. So I thought it was good idea to educate these parents, to provide um, better meals to their kids. So the community plan, of course, is to educate parents regarding sudden death, the proper way to place the infants in their crib to sleep, educate about the best position, which is actually the back, uh, provide education about malnutrition and their consequences, and also educate parents regarding proper meals and portions for toddlers. The intervention, of course, I am researching for the best sleep practices and appropriate dietary guideline for parents with children registered in daycare facilities here in Wisconsin, because daycare facilities, well, they have different policies by the states. So not the same thing that we have here in Madison. I mean, in Wisconsin, it's the same thing like it's in Florida, for instance. The final product, I'm planning to do a brochure to inform parents, regarding the sudden death in infants and prevent malnutrition among infants and toddlers. The distribution is planned to, if it's approved by the director or the principal, it will be part of the registration package and will be posted in bulletin boards to inform the actual parents. And it will be sent home as well in order to re-educate or reinforce the protocols. The evaluation methods the intervention will be evaluated by direct observation. The way how can be monitored is documenting if parents are positioned infants in supine position when they're getting dropped off, and also if caregivers will document food portions sent to the child care facility. So if the goals are not accomplished, then we have to find out new interventions. But I think performing meetings and inviting experts like family nurse practitioners or pediatrician, that they can reinforce the education and explain better the best practices. And for the meals, also providing meetings with dietitians and being able to customize meal plans according to every child's needs. This is an example. This is my small brochure, which basically the daycare that I'm doing everything is Trustner Child Care. So the idea is that they can send this to the parents, and parents can practice this in their own home and prevent sudden death. And this other one is for the healthy food portions. And here we can actually see the cups for every meal groups. So these are my two brochures that I come up with. So in conclusion, Nursing process applied to the city of Middleton, Wisconsin. The overview of the community.